Every Mpox patient should also be offered an HIV test. This is a crucial step because people living with HIV, especially those who are undiagnosed or untreated, are at much greater risk of severe Mpox. By identifying and supporting these patients, health systems can save lives and prevent further spread. Integrating HIV testing into Mpox care is now a global standard, and countries are being urged to make it routine. Vaccination is taking center stage. The WHO is emphasizing the importance of immunization as a frontline defense against Mpox. Vaccines are being distributed to clinics and hospitals, and health workers are being trained to administer them safely and efficiently. The goal is to build a wall of immunity around the most vulnerable populations, stopping the virus before it can gain a foothold. Countries are urged to prepare targeted vaccination campaigns for high-risk groups, using dose-sparing strategies if vaccine stocks are low. This means prioritizing people who are most likely to be exposed, such as healthcare workers, people in outbreak hotspots, and communities with higher rates of transmission. Creative solutions like splitting doses or using alternative delivery methods are being explored to stretch limited supplies and protect as many people as possible. Cross-border cooperation must be strengthened to improve surveillance and response, but crucially, the WHO warns against unnecessary travel or trade bans. Instead, countries are being encouraged to share information, coordinate health screenings at borders, and support each other with resources and expertise. The goal is to keep people safe without disrupting the flow of goods and essential services. Panic and isolation will only make the situation worse. Finally, the WHO calls for Mpox measures to be fully integrated into broader health programs, like those for HIV and other infections. This means building on existing infrastructure, sharing resources, and ensuring that Mpox doesn't divert attention from other critical health needs. By working together, health systems can become more resilient and better prepared for future outbreaks. Research into vaccines and animal transmission must accelerate, backed by both national and international funding. Scientists are racing to understand how the virus spreads, how it evolves, and how best to stop it. This includes studying animal reservoirs, developing new treatments, and improving existing vaccines. The world's top minds are being called upon to collaborate, share findings, and move quickly from the lab to the clinic. The take-home message: the world is at a crossroads. We can choose to act decisively, or we can risk letting Mpox become the next global health disaster.